The following is a production of KYNE TV in cooperation with UNO Television. Consider This with Carol Schrader, a news and informational program recorded on the campus of the University of Nebraska at Omaha. Here is your host, Carol Schrader.
Welcome to the Milo Bale Student Center at UNO. This particular Thursday in October is important to millions of American women and women throughout the world, as are all Thursdays. But the month of October is special because it's Breast Cancer Awareness Month. I'd like to introduce my guests today. They're all very special people. Sue Kostis is a breast cancer survivor who has an amazing story to tell on several levels about both her diagnosis, going through breast cancer, and even how much thought and feeling she has about it today. Dr. John Edney is a plastic and reconstructive surgeon and a co-author of a book called Straight Talk that talks about breast cancer and all its implications and ramifications. And Dr. Judy Durkheising is with us today, and she has the longest title of all. She's the administrative director of the Methodist Cancer Center and director of Methodist Behavioral Health. I want to welcome you all here.
Thank you.
I have the good fortune of knowing all of you, which makes this really special, but you don't have to know you to appreciate your stories. Sue, I'm going to start out with you because you're the one who's been there, done that, and is really doing it day to day. I think the biggest thing that strikes me is the scariness of your story, but also there's a lot to talk about what not to be scared about.
Right.
But when did your saga start?
Actually, I was about 32 when I felt a lump through breast self-exam. My mother had breast cancer when I was 30, and I started doing breast exams then after she had had cancer. And they found a lump in my breast and went to find out about that. And it was continuously diagnosed as fibrocystic disease, and I actually then went through 5 physicians, 2 insurance companies, and had a 20-month delay of diagnosis. And so that was almost 2 years, and I was 34 when I was diagnosed.
So you were more scared than probably, people look at it and they're scared to death of the whole idea, but the fact that you knew that there was 20 months in there where something could have been done, you must have been at your wit's end, going under the knife.
Right. I think my primary emotion was anger, because all the literature that you read says early diagnosis leads to a cure. And it was very difficult for me to feel like I could be cured when I knew that I had had this lump for almost 2 years. And I was angry at the physicians that I had gone to for a diagnosis. And I was afraid because I had 3 small children. My daughters were at that time ages 2, 5, and 8. And the fact that they could be left without a mother was a very scary thought.
But, and you went and you had a single...
I had a single mastectomy, and a year later had reconstructive surgery.
Now, Doc, I know you are not an oncologist. You are not the one that helps in the diagnosis, but I think probably the scariest thing other than facing cancer itself is the identity that's attached to those breasts. I still think that personally that women grow up, reach about age 11, and then their self-image takes a downturn, and we spend the rest of our lives sort of recovering. And we're really tied into, from the time we're young, is what size you wear, when you get your first bra. There's so much attached to that. And you deal, and from what your patients tell me, you are probably one of the most empathetic men they know. I don't know what you're like at home, but they're certainly giving you high marks. What do you feel about the fear of losing those breasts, as if the cancer isn't scary enough?
Well, the people we see in the office in consultation for reconstructive surgery are the women that have kind of selected themselves as wanting breast reconstruction and want some form of treatment that has breast preservation, as opposed to just removing the breast and having nothing there. So those are the patients we see, and their story, they tell us why they're requesting breast reconstruction. The number one reason is they just want to feel whole again. They want to feel like nothing happened, like they've been restored, and try to put the cancer experience behind them. And then the next level down would be want to look and feel comfortable in all types of clothing. But we see that fear in their eyes of not only the cancer, but when they look at us and they say, I don't want to wake up with nothing there. You know, I mean, that's right after they've said, I'm worried about the cancer. Those people do worry about not having anything there. And there are many women who feel comfortable not having anything done. So it isn't like we expect every woman to want to have that operation, but for those that do, you know, we have good options, and we can do a lot for them.
Judy, I think that you're working with a cancer center, and your background is in more a psychological
clinical social work
approach to things, and dealing with the person and not necessarily the disease. But we are dealing with the disease that I had a breast tumor once. It was just a fibroid tumor. I was 23. But I remember them saying that when I was coming out of the anesthetic and wanted to know if it was cancer, that I was using all kinds of language that I now use regularly, but at that time in my life, never did. And I think that was fear, and you know, I wasn't registering what they were telling me because I was out of it. I mean, there is so much incredible fear, and then that fear of losing your persona as well as your life.
Yes.
I mean, we are getting early detection. You certainly tried. And I think we're getting some good statistics back on that. So there is good news, but what are we really dealing with in this awareness situation to get women to do the right thing all along?
Well, I think you hit it on the head in some regard, is that many times women step away from going to find out what a lump is, or even denying themselves the opportunity to learn breast self-exam because they're fearful. What if I find something? How will I be able to manage it?
But aren't we all that way? I know I was.
Sure. And I think probably the most intense thing we can do is continue education. As Sue has said, having women find and detect breast cancer early has so much to do with survivorship and the ability to have the best outcome. And so I think we continue to educate, and we continue to educate, and we continue to educate.
But we've made terrific strides, for instance, in having insurance companies recognize the right in all forms of female cancer, the pap smear, the mammogram. Well, it took Congress to have something to do with that. And there are some more cure type things that are approved by insurance companies now. But there are still horror stories of women who face a lump, try to get help, and don't get the treatment they want or fight an insurance company. I mean, it's enough of an uphill battle just to face a lump.
Well, and I think that's where letting women know the resources that are available as well, and not just women, family members as well. We're very fortunate in our community to have Every Woman Matters program, to have some other kinds of resources that are available if there is something found to help the individual get treatment and find the right kind of recovery, all the way from physical treatment to emotional care, because the diagnosis of cancer is very much a trauma. It's a natural trauma as far as someone's emotional reaction. You described your emotional reaction from having the tumor or cyst removed for yourself, and you personify that times 10 when you find out that it is cancer. And I think many times we just don't know what's available, and that's why we need to be able to call. Any hospital in the city could give you resources that would be available for diagnosis and treatment. And that's important to know that that's there. To say there's nothing that can help you is wrong in Nebraska. There's much that can help you.
Maybe we should talk about the Every Woman Matters program that has made mammography available to literally thousands of Nebraska women, and that has got to be a godsend, all the way from the beginning of the situation to maybe even the end, where you find out that your job in reconstruction is a lot less because people were able to do something early. I mean, it just runs the whole gamut. What is it exactly? It's been in effect for what, 3 years now, 2 years?
It's been for a number of years. I cannot give you the exact number. I think it's even been more than 3. But it really is set up to provide diagnostic tests more than treatment. It is not set up to pay for the treatment, but to be able to pay the cost of diagnosis for an individual, for a woman, and then to certainly, again, find the other resources that are available around treatment. But there should be nothing that should keep you from being able to get an appropriate kind of test or diagnosis to see if there is a problem or not. The test is Every Woman Matters is very much supported by a number of different agencies, the Susan B. Komen Foundation, the Race for the Cure, resources that are within our particular state, tax dollars, a number of things that support that particular program.
We'll talk about the Komen Foundation and the Race for the Cure. I want to talk about that at the end, which has already happened for this year. But Sue, we go back to your case where, I mean, this is, I suppose, the greatest fear after you conquer the fear that I have a lump or I have a suspect situation, or I'm even trying to decide to get regular mammograms, facing just the fear that even a regular test would be admitting that I could have cancer.
Right.
Do you walk around saying, this could happen to you, or do you see yourself as a rare situation?
I find myself at that time, especially in younger women, I think it happened more prevalently than it does now. And because of education, I think it does happen a little bit less
But it's
now.
just the odds are that you wouldn't. But you had it in
Right.
your family.
But there's also a misconception with hereditary breast cancer that's only actually like 8 to 11% of breast cancer is hereditary breast cancer. 70% of the women who are diagnosed had no known risk factors, and so really that could be anybody. And I think for myself, I lead a healthy lifestyle. I've never smoked. I'm a vegetarian. I walk or run every day, and I play tennis probably 2 to 3 times a week. And so I have a very healthy lifestyle, and I probably didn't look like the 1 in 8 statistic sitting in a doctor's office saying I could have breast cancer, although my mother did have breast cancer. I think the young age had a lot to do with it also, but young women are more and more being diagnosed. And my mammograms, I had 2 mammograms, and they were false negatives because younger women have dense breast tissue. And so actually when they said, your mammogram's negative, that's what I wanted to hear. And I did let down my guard somewhat, although I still retained the lump in my breast, which gave me the little voice that kept me going to doctors 2, 3, 4, and 5, and ultimately changing insurance companies and going back to the physician that delivered my children, who I had a doctor-patient relationship with, and he listened to the little voice and did a biopsy.
So we have hopefully better diagnosis than we had years ago. We have certainly better doorways to getting diagnosis, and a variety of not only options in whether how much to take, how radical to be in that approach, and afterwards if you want to have some work done, and that can be right when the one surgeon walks out the door and the other one walks in many cases. So are we really making any headway to increasing early diagnosis? We're finding out it does help, but are we making a lot of headway? Who wants to tackle that one?
I think we are, Carol. I think that there are more people that are more compliant about their mammograms on a yearly basis. And I think it all has to do with awareness, where people realize that there hasn't been any tremendous strides in the increase. There hasn't been any great increase in survivability just because of changes in surgical techniques or even chemotherapy. The big changes have come with earlier detection as people understand that they're more compliant with their mammography. However, there's still a long way to go, because there's still a lot of women who don't do that, even though they're being made available through such things as the Every Woman Matters program.
I think something that's very encouraging for the public to see is the amount of survivors that there are. 1 in 8 women is diagnosed with breast cancer, but there are so many women that survive. I think that's encouraging then to go and seek a mammogram or do the breast self-exam and know that if you were diagnosed, that you most probably would survive.
One of the things that I find, and I'll talk about the Race for the Cure now. I've had the privilege of being asked to go and serve in some capacity for a couple of them, and I've been to 4. And I will tell you that even not having had breast cancer and not having that particular cancer running rampant in my family, that the whole aliveness of it is probably, and I've been to tons of different races, everything from the corporate cup run. I don't run. I'm sort of religiously opposed to exercise, but but I mean, they're all, you know, they're all with it. They're healthy people. There is no more spirit of life at any event that I have ever been at than the Race for the Cure. And you'll see the stars on the visors, the pink visors of the women, denoting the number of years that they have survived. But these people and their relatives, their spouses, their children, their mothers are, I mean, talk about an appreciation. And I wish every woman that mattered could see that, because they would see that the fear factor, although it probably existed and still does, pales in comparison to this spirit. Is that my imagination, or am I just overly dramatic?
No, I think there's a great people perspective there, and this year they had 2,600 entries, and it's just a river of people down Pacific Street, and it's just, if you look at that, those are actual statistics, alive and walking around and enjoying life.
You know, you're a guy. Did you ever notice that, Dr. Edney?
I did.
It's amazing.
It's been pointed out to me before.
I bet. It's amazing how many guys are responsible for some of the early detection, and I don't want to get into it, but we have intimate relationships going on in this world. That's how we end up with children. And in my case, my husband discovered the lump. The lady who does my nails, her husband discovered the lump. This is not unusual. So for men to think, this isn't my deal, this isn't my gig, they may be very wrong.
Well, and I think also from an emotional point of view, having that partner be very supportive of you. If you do have a concern, if you do have a lump, if it turns out to be a malignant lump. You know, the literature 20-some years ago used to say that spouses, partners rejected the woman who had breast cancer and who had surgery. Whereas we look at it a little bit more closely in the last 20 years, what's really said is that it's really a couple issue, and that it may not be the spouse, the partner that's rejecting as much as it is the person feeling bad about themselves who has actually been diagnosed and had treatment, had surgery, and maybe pushing away and being a little uncertain about their identity at that point and how they're feeling, and Sue could give us a good amount of information about that. So it really isn't that partner. It's a very rare experience to have the partner reject a woman once she has been diagnosed with breast cancer and even has lost a part of her body.
Well, one of the breakthrough television stories was of Betsy Rollins, I believe, was a television reporter. But that was a double-edged sword. She was one of the first to write about breast cancer and the feelings that are associated with it. But in that particular case, her husband did have a problem. So I think that put even, in a sense, more fear in the minds of some women that ejection is, I mean, it was good that it came out, but it was just part of the evolution of being able to come out and talk about this. And now you so beautifully, if you'd read some of Sue's writing about her experience with breast cancer, some of the most sensitive writing I've ever read, your ability to articulate it, but this wouldn't happen 20 years ago.
Right. And actually, I think a lot of family histories are not known as a result of not talking about it. Women, and I think Judy had an example where, could you talk about, did you have an example where there was a student that had an assignment to write about breast cancer, and she went home and was discussing this out loud, and then I think the grandmother was in the home and said, well, I had that, and neither the mother nor the granddaughter knew that the grandmother had breast cancer because they didn't talk about it
and this was
at
a
that
young woman in college who was taking a woman's history course at a university, and one of the teaching mechanisms was to read a book that was written by breast cancer survivors.
Here she had one in her very own family.
And didn't know about that. And for her own health, that was important, but at that time they didn't talk about that. And I think it's a benefit that we have now that we are more open.
One of the reasons I bring that up is because the women I know very well who have had breast cancer, and some of them now go out and talk to other women, but the groups that have formed, the support groups, and that's sort of become not a dirty word, but there's support groups for everything, so it almost is like you don't want to go, because gosh, they're everywhere. But the women talking to women and working with women has been a phenomenal success. I know many of your own patients have helped school other women.
Oh, they do. We have, it's interesting, they meet each other in the waiting room of the office. Sometimes they get to know each other better than we want because they sometimes keep them waiting longer than we want. But we've had, I even had one experience where a lady came in for a consult for breast reconstruction and said that she had just talked to a woman who had it and got to see her reconstruct her breast. And I said, well, where did you do that? And she goes, in your waiting room. I thought maybe we ought to spend more time in the waiting room, see what's going on out there. But she.
But the point is that they're feel good about themselves, or they would not show that reconstruction.
Right.
And so that feeling is contagious.
Well, it is, and and we do cosmetic surgery and we do reconstructive surgery. Patients who've had cosmetic surgery are very private about it. They don't want to talk about it. But the women who've had reconstructive surgery, I've never met one who wasn't just anxious to talk to the next person who had it and want to tell them their experience and how things went. And so it is a very open thing, and I think it does. You do see them feel better and heal, I think, during that time when they do that. I think that one of the things that we experience as we watch them and listen to them, we see them from the day they get diagnosed many times to the end, past chemotherapy when we're finishing our part. So we'll see them over maybe a year and a half and 2 years, and then every year after that. But as we see them go through that, you see a change in these women. You see a change, and I saw a big change in Sue, from anger and one to taking this and making it an experience that, and it may sound kind of corny, but we really do learn from that. We, having seen all the women who come through, I guess if something ever happens to me, I'm going to feel that I better not be a wimp about it because these women aren't. So they do a good job.
Cancer is always something that, although it's a part of you, you want to eject it from your body, and if you can't, and you have to have chemo, which means that you're afraid it's still in you, it's like you want to get it out. But cancer and the remnant that's left emotionally is an internalized thing, and I think that breast cancer survivors probably better than any cancer survivor I know. Maybe it's because of their breasts and the self-image and persona they have with their physical being as well as their emotional being, are able to really take that experience into them as part of who they are, just tremendously well, if their attitude is right and they meet the right people. Do you worry about those that have a problem, Doctor? You see them, Judy, and I'm sure you've met with them who you just can't kind of. Or maybe they take their own time about it, or they're very private about it and can't talk about it. Does that worry you when they can't?
Yes, because I feel that it's only human nature in a negative experience to try to find a positive experience, because it makes that experience worthwhile then. And it's very difficult to go forward if you can't find the positiveness in that experience. And so you wonder then with women who did survive breast cancer if they have internalized that and haven't found something positive through that experience, like the quality of the rest of their life and how it's affecting their family and friends also, not only them, And with support groups, we do try to encourage interaction and talking about it.
Does the fact that women are, in addition to having a cancer, be this physical attachment being involved, that cancer in the breast, and the fact that women are caretakers by nature, they're nurturers, and they have children they have to worry about oftentimes. They have maybe parents that are aging while they're suffering from breast cancer. Do you find that has a difference in their outlook, knowing different kinds of cancers as you do?
I think generally, I certainly wouldn't draw it across the board,
right.
But I think generally people in general, and we're talking about women today, who have had positive attitudes in their life, who have dealt with some crisis in their life, who have raising children, who are whatever, working in the home or outside of the home, their life experiences give them the energy and the ability to deal however they decide to deal with this effort. And I think because they are caregivers, there's a tendency sometimes to neglect themselves And so they really need to say it's okay to ask for help. It's okay for the neighbor to bring a dinner over. It's okay for my friend to take the kids to school. I don't have to be Superwoman. It's
Oh,
time
like you
now
do
to
when you
take
have the
care-
job and you have to have the
You
clean
got it.
house and you
That's
have to
right.
take care of the kids.
And so maybe getting through this means I pay some attention to this and not ignore everyone and everything around me, but this is the attention of caring for myself. And I think the other thing, you brought up group. We had a group of women last night because of Cancer Awareness Month, Breast Cancer Awareness Month, who came together from 3 of our support groups. There were 47 women who came together to look at each other from these 3 groups that we have. And you have women in there 28 years out. You have women who still don't have their hair back from going through treatment. And the sorority that they're in, the one they didn't choose to be in, is truly supportive. Every woman doesn't fit into a group, a small group or a large group, but you can get support from another woman who's been there by talking to someone on the phone. And those are the resources that are available too, by being able to call someone and say, this is what I experienced, did you go through that? Or this is how I'm dealing, or I'm a very private person, I don't want to meet one-to-one, but it's okay to talk on the phone. You need to take care of yourself.
Well, I just want to say that Sue does a lot of expressing her feelings about this through her writing and certainly through her art and her photographs, which if you ever get a chance to see, you should. Dr. Edney, I do want to talk a little bit about the book Straight Talk that you wrote and co-authored with
Dr. Suzanne Braddock, Dr. Jane Kircher, and Melanie Morrissey Clark.
And what is it when you say it's, I'm assuming it's Straight Talk about breast cancer, but what?
Let me tell you how it started. Suzanne Braddock had breast cancer.
She's a dermatologist.
Right,
in town.
she's a dermatologist here in Omaha, and she had breast cancer, and she had both breasts removed, and she's very open about this. Normally we wouldn't talk about our patients, but she writes about it in the book. So she had, and then she had reconstruction, she had chemotherapy, and when it was all over, she was frustrated because there wasn't one book easy to read that a person could just pick up during that time when they don't want a huge amount of information, they just want what they need to know.
Enough.
So she came to me and said, how about let's write a book? And I said, simple to say, hard to do, but we asked Melanie Morrissey Clark to help us, and we did all the scientific writing. She helped us put it together and got it published, and been pleasantly surprised how well it's been accepted. But that's how it came.
And we should say you're not making millions off this. A lot of this is going to...
No, what we did was we're into the profit side of things now, and it's not a lot, but all those profits go to various breast cancer causes. We just gave a good portion of it to a patient who needs a bone marrow transplant who doesn't have the money. And that's where those funds were going to go. So
We have about a minute left, and I want to give you a chance to plug your center and what it does. And you're very good at speaking briefly, so.
Okay, well, Methodist Cancer Center is basically a center that is there to do education, diagnosis, and treatment of any kind of cancer. And there is a large educational library there, patient education, community education, and it is indeed open to the community, so everyone is welcome.
Okay, we've run out of time, but the thing is that you don't have to run out of time, so get the information you need and help others. I want to thank Sue Kosis, Dr. John Edney, and Dr. Judith Durkhuizen. Thank you very much for joining us today
Thank you, Carol.
on Consider This.